March 21st, 2025, Dr. Ron Coe, who is a very popular dentist in one of the big cities in Washington state, woke up from surgery completely paralyzed and now permanently paralyzed from the chest down. His lawsuit alleges there was a failure in safety standards. So this is horrific. And thankfully, these types of devastating outcomes are few, but when it happens to you or when it happens to anybody, it's devastating. And if it had to do with a failure on the part of safety protocols or something that was an error, it's just inexcusable. But it has happened, so what can we learn from this? Dr. Coe was scheduled for surgery to have what he alleges was told to him to be a low-risk surgery, low risk of complications, and the outcome would be favorable for him, and he would be back to work as a dentist and a father of two, happily married man within a couple months of his surgery. He was diagnosed with a benign tumor on his spinal cord, on or near his spinal cord. He was scheduled to have surgery to have that biopsied and possibly removed, but something went terribly wrong in the operating room, and this is what he is alleging. I'm going to read to you exactly what it says happened in surgery. The surgical team intended a standard tumor biopsy or resection. The neuromonitoring alert that is taking place during spine brain surgeries, the neuromonitoring alert system dropped 70% during his surgery. That's an alarm that is indicating you need to do something. Pay attention to this. There's going to be a possible bad outcome if things don't stop, pause, or change. That's why those alarms are in place for people who have spine or brain surgery. He's alleging that they ignored it, and they did continue with the surgery, is what has been stated, and the outcome has been paralysis for him. So what else is Dr. Coe alleging happened? He states that he wasn't told right away about the loss of neuromonitoring in the operating room. And of course, the question why, if that alarm is going off, why wasn't there a pause or stop or position change or just abort the surgery altogether? I don't know that we'll know. Will we ever know what's going on in the head of those physicians? So the other thing that Dr. Coe states is that he did not approve of and didn't know that residents were going to be the ones performing surgery on him. He understood that it would be fellowship trained neurosurgeons. So, after medical school and residency, then there's the fellowship. So they're training at the University of Washington Harborview Medical Center. He states that if he would have known that it was residents doing this surgery, he would not have approved that. Dr. Coe states that he knows it's a medical center. He understands that residents might be there, but they are there to observe. He did not state that he wanted the residents to do this surgery on him, but knew that they would be there to be observing, not actually performing his surgery. So Dr. Coe has now filed a tort claim against the University of Washington Harborview Medical Center and the residents who performed his surgery. Perhaps more people than that, but that is all that I see at this time. This is really tragic. I mean, the point of the neuro monitoring that goes on in operations such as this is to prevent paralysis and damage. And instead, it caused permanent paralysis for this man. This has made it so this dentist cannot live a normal life again. He's been in the hospital a long time. I'm not sure if he's at rehab at this point. He can't be the same father or husband that he was, and he can't return to work, if at all, the way he once did. So when we think about someone who's paralyzed, it's so much more than that. It's all the other things that go on with paralysis. It's bowel and bladder issues that are permanent. It's cardiac and blood pressure issues that could possibly take place. It might be headaches. It is obviously mobility issues, even if you're in a wheelchair and you've got assistance and you've got round-the-clock care in your home, or you don't and your wife is your caregiver. Your lives are changing drastically. You're dealing with so many other symptoms that go on with your paralysis. It isn't just that you are unable to walk again. Oh, these kinds of cases just really are upsetting. But what can we learn about this? Here are some things I think that would be absolutely beneficial for patients going into surgery. So every time I talk about problems that have happened in the medical field, I always talk about what possibly could have helped to avoid this. And even if everything is absolutely in place, in line, and everything has been done properly, we all know that unfavorable outcomes can still happen. But in this case, we know, according to what he has alleged, that two things occurred. One, perhaps people who weren't skilled enough to handle his surgery, the residents versus the other neurosurgeons, were performing surgery on him and shouldn't have. And secondly, as he alleges, that the monitor was going off indicating there's a problem, and a pause or abort of this surgery did not happen, instead continued to go on, even though the alarms are saying there's an issue and paralysis could occur. So I always, like I said, talk about, well, what in the world? What could we do differently? And what more can we do to try our best to make sure that we're doing everything in our power with communication with our surgeon and the surgical team to what is happening to us. What is our responsibility in this? I want to go over a few what, how, who types of questions that I think are really critical to talk about and to discuss openly with your surgeon before surgery and then before you go into the operating room in the pre-op section. And here are a few things. What is my surgery? Is it necessary that I have this surgery? You could follow that up with, if I didn't have surgery, what would happen? And if I do need to have the surgery, please explain exactly what you're going to do in this operation. And I realize that a lot of people go into surgeries, and believe it or not, during pre-op, what are you in for, Mrs. Smith? I have no idea. He's just going to fix my leg. I have no idea. But make it your priority that you fully understand what the surgery is, how it's going to be performed. It's really necessary to have an advocate with you so that that person can be there with you to take notes with you, to help you understand it better, and to ask questions as well. Since I have to have this surgery, what are the complications? And most surgeons are going to explain these things to you before you have the operation, before that day ever occurs. When you're seeing that surgeon in the clinic and you're talking about how that surgeon could help you, they're going to go over a lot of these things. But even I know, like when I had my hip replacement and the other hip surgery prior, there are so many things that I should have asked that I didn't ask. Mainly mine had to do with what could the complications be, because it seemed to be indicated to me, the way I heard it was, this is easy breezy, probably how Dr. Koh heard it. This is considered low risk. This is a real simple thing. It's going to be okay. You'll be back to work before you know it, within a couple months, for example. Well, when you hear that, you're not thinking, could I be paralyzed? Oh, and that was another thing that Dr. Ron Koh has said, that nobody told him that paralysis, or even permanent paralysis or temporary paralysis, could occur. He said nobody said that to him. Full disclosure, you're going to ask, what could these complications be? Another really important what question is, what's the success rate of this surgery? Are you going to be doing my surgery? We're back to who's going to do it. And have you done this surgery quite a bit? Don't feel embarrassed to ask these questions, and don't feel as though you are putting the doctor on the spot, because a good surgeon should be telling you these things ahead of time. It's easy to forget about it, or to come back later pre-op and say, I thought about it and I have a couple other questions. If they give you an attitude, that's not acceptable. It's their job to explain everything to you completely and fully, and you understand it, and your questions are asked before you go into the operating room. What is my recovery going to be like? If they say your recovery should look like this, and then you have complications afterwards, I'm not talking about Dr. Koh's case where he woke up paralyzed and he's probably still in the hospital or rehab because it's only been 3 months. But I'm talking about some of my other videos, for example, chronic pain, something doesn't feel right. Please speak up. Please go back until you get answers. Go to a different physician if you need to. When it comes to who will be doing my surgery, I want you to be comfortable in the answer. If your surgeon says, this is a teaching hospital, we are here to teach others, they will be here in the operating room, or they'll be in the operating room with me. You can say, I don't want them doing surgery on me though. I'm only saying that I want you to do the surgery on me. And that is perfectly okay. That is your right to say that. Things do happen though. We don't always know exactly what's going on in there. So when you say that, you are being really clear what you, no thank you to the resident. I don't want the resident doing my spine surgery. I want you doing my spine surgery. And then when you are signing the consent form is explaining all of these questions that we're discussing right now. It's explaining them. You're going to sign and date this. Your surgeon's going to look at this consent form too. And it should say in there, you can write it in there. You're covering yourself. You're stating it clearly. No thank you to the resident to do my surgery. Specifically to do my surgery. Because if you say I don't want the resident in there, I don't know that, would that be honored? I don't know. So I remember when I had meningitis and the ER doctor said, this is a teaching hospital, this is a medical center, this is how they learn, this is Dr. So-and-so, he's a resident, and he would like to do your lumbar puncture on your spinal tap. Is that okay? And I said, no, thank you, that's not okay. I want you to do it. And he said, no problem. Can he? And I said, he can be in here and he can watch. So if they cop an attitude, well, that's not okay. And you have the right to say no to what surgeon is doing your surgery when you are hiring this doctor, but then somebody else wants to come in and put their hands in there and do the surgery instead. You should know all of this up front. I'm hoping for the best with Dr. Ron Coe. He is in this state and he was practicing very close to where I live. And I have gone to the University of Washington for surgery before. I have used Harborview many times. They're connected. They work together. They're two big and wonderful medical centers. So just like I've talked about in my other videos, everything can be done right. And you can go to the best hospital. You can go to a very reputable hospital or medical center and still things can go wrong. But when something has gone wrong that was completely avoidable, well, that's another situation altogether. And this is just a tragic, unfortunate, devastating outcome for this dentist. And I pray that he continues to heal the best that he can. Remember, it's not just about how to use a wheelchair now. It's about all the other complications and medical diagnoses that he has as a result of being a paraplegic now. And I wish the best for his beautiful family, because their lives have all turned upside down due to an alleged error in safety and miscommunication before the surgery even took place. The only thing we can do is learn from these tragedies that occur and try to do better each and every time. If you like stories about medicine, about myths and facts about medicine, ways to be a better advocate for yourself or for a loved one, please consider subscribing. And if you think that this would be helpful for other people, please share and please give it a thumbs up, because remember, it's free and it helps so that other people can view the video. See you at the next video.